Now I'll discuss about bronchiectasis. It is defined as chronic infection of airways leading to abnormal permanent dilatation of bronchi or bronchioles. Abnormal dilatation of bronchi or bronchioles. Causes first is infection, that is post-infective causes tuberculosis, necrotizing pneumonia, whooping cough pneumonia. After infection, that is post-infective causes, then immune-related causes like immune deficiency, primary and the secondary, hyperimmune reaction, allergic bronchopulmonary aspergillosis. Then third is impaired mucociliary destruction like cystic fibrosis, primary ciliary dyskinesia, and Cartagner syndrome. So these are the impaired mucociliary clearance, cystic fibrosis, primary ciliary dyskinesia, and Cartagner syndrome. And lastly, insult to the bronchus like obstruction, repeated gastric aspiration, and toxic fumes. So these all causes can cause abnormal permanent dilation of bronchi or bronchial or bronchiectasis. Repeated infection and airway will cause weakness, which ultimately leads to permanent structural deformity, which is the root of this bronchiectasis. Now, what are the clinical features? First is symptom chronic productive cough, often mucopurulent or purulent. Productive cough, mucopurulent or purulent, may be foul smelling. Volume and appearance of cough suddenly changes during infective spells or exacerbation. There is breathlessness. And hemoptysis, it may be massive due to rupture of bronchial artery as well as erosion of bronchial wall. Hemoptysis can be present in bronchiectasis. Now, what are the signs? In pulse oximetry, there will be low oxygen saturation. Clubbing may be present, and respiratory system, often coarse crepitation are present, which may diffuse or localize depending upon the extent of distribution of bronchiectasis. How will you investigate? Hemoglobin TCDC, ESSCRP, sputum, gram stain and culture sensitivity is done. Blood culture during infective exacerbation. Chest X-ray charges suggestive of bronchiectasis. Chest X-ray changes suggestive of bronchiectasis. This is the X-ray of the bronchiectasis. CT scan confirms the diagnosis, and other tests to look for underlying causes. How will you treat? Antibiotic therapy, two types, short term or long term. Short term during the exacerbation and long term for prophylaxis. Bronchodilators can be given in case of airway obstruction, clearance of airway secretion, that is by bronchial toileting, postural drainage, chest physiotherapy, special breathing exercise, and cough assisting device. So those are the for the clearance of airway secretion. Then surgery is done, removal of the bronchiectatic area, and vaccines, influenza vaccine yearly and pneumococcal vaccine single dose. So these are the treatment: antibiotic, bronchodilator, clearance of airway secretion, surgery, and vaccine.